This is an Egbete community situated some days, there comes the Ugemobo Festival, which the Oba celebrates outside the palace gate. A pavilion is built of red cloth where rites are performed to drive away all evil spirits still unsatisfied by the year's sacrifices. The Emobo Festival is to commemorate an event in Benin history which dates back to 1504 AD.
Certainly the best.
Thank you for joining us in the program held to Living on ITV. I am Adisuwa Sawage. So sometimes when your stomach is having a party, like a bit of a wide party, and a lot of things are going on in your stomach, and sometimes you'll be wondering what's really happening. Why are all the women having a party? What is happening to me? You may not know. So today we want to talk about peptic ulcer disease. And we have Dr. Jolly Nosa Igoma, who is going to be talking to us about that little party that always happens in your stomach, that one that you neglect, where to go to, how to go about it, and how to know if you are suffering from peptic ulcer disease. Dr. Nosa Jolly Igoma, a pleasure to have you join us today.
It's my pleasure.
Thank you. And it's like we're meeting for the first time this year.
Yes, yes. Happy New
that's
Year.
Awesome. Thank you for joining us. So, doctor, quickly, talk to us about peptic ulcer disease. What is it? What are the causes, the symptoms, and of course, maybe possible treatment and prevention? Let's do all of that.
Yes. Peptic ulcer disease is the commonest disease condition that we have in gastroenterology. What I'm saying is that the field of medicine that is concerned about the disease that affects the intestine, that has to do with the abdomen. has to do with gastroenterology. So that is to say that patients will always come down with pain in the abdomen. And there are different organs in the abdomen. And those organs play a different role. For as much as we humans, we eat to survive, it therefore means that there are organs that are concerned about digestion.
Okay.
And one of those prominent organs that is concerned for digestion is the stomach. The stomach also produces an acid, what refers to as the hydrochloric acid. Any food that you eat that goes to the mouth, masticates, the tooth process, it goes to the esophagus, which is the gullet. From there, it goes to the stomach. The stomach produces an acid, and the essence of this acid is to help to detoxify and, tend to destroy every microorganism that will have been in the food that we have ingested or eaten. But you get to understand that this acid, as well as the pepsin, can also act as an agent that will eat up those organs.
Okay.
So, for example, when the hydrochloric acid that is produced by the stomach, when it begins to destroy the stomach wall itself, somebody can begin to have a sore.
So why does it destroy the lining of the stomach?
There are factors that are responsible for this. Of course, the word peptic ulcer means that we can have sore in the esophagus, we can have sore in the stomach, we can have sore in the duodenum. That is to say that we have 3 types of ulcers. We have 3 types of peptic ulcers. It can be esophagus, that is the gullet. It can be the stomach itself. It can also be the first part of the small intestine, which is the duodenum. You see, there are some risk factors that will make somebody to be prone to developing this destruction of the lining of the mucosa, which covers, the stomach wall and the duodenum, to prevent acid from destroying them. Normally, there are defense mechanism. It's supposed to be protected against self-destruction. But when somebody has an exposure to an organism refers to as Helicobacter pylori,
and what is
the commonest cause of ulcer worldwide is a bacterial infection.
Okay.
It's
not the ingestion of too much pepper, because that's
what people believe. But I will tell you that when you ingest pepper because of the spiciness of those pepper, you must have an ulcer. I would say that the pepper itself is an aggravating or a triggering factor. So the commonest cause of ulcer is presence of bacteria,
and so
which you can actually
not fasting, not starving yourself of food. Not
at all. It's just one of it anyway, but it doesn't come first. But somebody that has an ulcer and is not, undergoing prolonged fasting, it tends to exacerbate it. It tends to bring about relapse or remission in any way, because the ulcer itself is a chronic disease condition that lasts a decade, even sometimes a lifetime. For as much as once you are diagnosed of ulcer, yes, even when we know that the incriminating factor is a Helicobacter pylori, even after the elimination therapy, when the causative agent has been removed, there are do's and don'ts. There are some certain food you have to abstain from to avoid this relapse of this ulcer. So the Helicobacter pylori is the commonest cause of this ulcer, which is capable of causing destruction to the lining of the mucosa of the stomach, as well as the duodenum. How do we get this Helicobacter pylori? We can get it through fecal-oral route, as in maybe coming in contact with stool of somebody who has a Helicobacter pylori. Using toothbrush used by somebody that has a Helicobacter pylori. Vomiting, coming in contact with vomiting. Because it dwells in the stomach. That is where the bacteria dwells. And what this bacteria causes is to cause destruction of the lining of the stomach. Not only that, apart from the Helicobacter pylori, we also have people that abuse pain medication. You see, pain is the commonest symptom. Some person come down with tooth pain, they come down with rheumatoid arthritis, they come down with headache, they come down with all kinds of pain. And when you take pain without doctor prescription,
that's why you take painkillers.
You take painkillers, exactly. When it's actually a non-steroidal anti-inflammatory.
And that's one of those drugs that people abuse.
Yes, it's the commonest drug of abuse. I will tell you that the possible disadvantage or complication, the NSAID, the non-steroidal anti-inflammatory drugs, those painkillers will cause for you is the ulcer. So those NSAID can also cause destruction to the lining of the mucosas of those stomach or the duodenum I told you about. Not only that, apart from those NSAIDs, we also have people that take alcohol. Excessive alcohol abuse can also cause destruction. Not only that, people that smoke. You see that the cigarette that people smoke, the cigarette contains a carcinogenic substance, the benzoyl-heparin. And when the benzoyl-heparin is digested, because of the metabolite it forms, like the benzoyl-heparin 7-hydroxydithionepoxide, it tends to, cause destruction to the lining of the stomach, thereby causing patients to be prone to developing peptic ulcer.
Okay.
Not only that, there are some disease conditions when you are in stress during deprivation, during stress, during, passing through acute difficulties, you can begin to have stress ulcer.
Okay, doctor, I'm going to pause you there. We'll take a short break, and when we come back, you have opportunity to ask Dr. Jolly questions that borders on this topic we're talking about today, peptic ulcer. If you have any question at all to call Dr. Jolly, we'll put the number on air so that you can call us. We'll take a short break now.
Some days, there comes the Ugemobo Festival, which the Oba celebrates outside the palace gate. A pavilion is built of red cloth where rites are performed to drive away all evil spirits still unsatisfied.
Very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is
Thank you so much for joining us again on the program Healthy Living. If you check your screen now, the phone number is there. Please copy it and give us a call so that you can ask Dr. Jolly any question you want to ask on peptic ulcer. A lot of persons at least today we know that peptic ulcer is not caused by fasting or starving yourself and all of that. There is something already in your system that causes it. And if you come in contact with all that Dr. Jolly have said to us this afternoon, so give us a call on that number on your screen right away, and you'll be able to talk to Dr. Jolly Nosa Iguma. So Dr. Jolly, let's look at the symptoms of peptic ulcer disease. How will somebody know that he or she has peptic ulcer?
Yes, the commonest symptom of peptic ulcer is pain in the epigastrium. The person will have pain between the breast or sometimes in the upper part of the chest region. And this pain is a bony pain that can even wake patients up at night.
Okay.
Or that comes up very early hour of the day, that is very early in the morning. The pain, very excruciating. Apart from pain, patient can also have indigestion. Patient can have nausea and vomiting. They can have loss of appetite for food. And patient can also experience bleeding, usually when there is a complication, what we call hemorrhagic peptic ulcer. Not only that, there might be food refusal or the tendency to now begin to eat, little foods. That is when there are complications. Not only that, patients can also experience weight loss or can also experience what we call anemia, usually when the symptom is asymptomatic, other than patient just going for medical assessment and we now find out that the PCV has reduced, not knowing that there have been passage of blood through the stool.
Is it self-diagnosed or you have to go to the hospital to find out?
Yes, just like as I said earlier on, the commonest symptom of this ulcer is pain, which is usually felt at between the breast, but not ulcer will manifest symptoms. Some ulcers is just asymptomatic until the complications start coming, like a patient that is bleeding, that is experiencing hemorrhagic peptic ulcer, is bleeding, in the having upper GIT bleeding. So such patients, when there's stool, there's usually passage of melanal stool, what we call dark stool. So that patient might begin to have weakness over time because of the excessive loss of blood, via the stool. And when a laboratory investigation is now conducted, we'll now find out that the PCV has reduced. So in trying to evaluate the cause of the PCV, we now know that, this patient has an ulcer after doing other laboratory test or investigation.
All right, the number to call is 0807777, that's 470300. Call in to ask Dr. Jolly questions about peptic ulcer. Perhaps you're suffering from it, or somebody who is suffering from all of the symptoms that he has mentioned. Okay, Dr. Jolly, is it a preventable disease, curable disease, treatable disease? Let us know.
Yes, ulcer is a preventable disease, but it's a worldwide disease, and persons with blood group A, we research, are most likely to suffer the gastric ulcer.
Okay, blood group A.
Blood group A, yes. People
not
with blood
genotype
group A,
now,
yes.
so don't mistake it. Genotype is different from blood group.
Blood group A,
positive or negative?
No, either positive or negative. As far as you are blood group A, you are most likely going to suffer the gastric ulcer. Whereas those that are blood group O, they will have what we call the duodenal ulcer. Not only that, for people that are older, maybe from the age of 45 to 60, 45 and above, they come down more with, duodenal ulcer. Whereas the gastric ulcer, people that are younger, 20s, 30s, as the case may be. But in overall, I will tell you that in preventing the peptic ulcer, other than those predisposing,
factors that you've mentioned already. Yeah.
When you are avoiding smoking, automatically you are preventing ulcer for yourself. And when you also mind the kind of drug that you take, that will iatrogenically result to the destruction of the lining of the stomach.
Well, you just talk about painkillers being a factor. What about prescription drugs?
Yes. When you take prescription, when pain is actually a symptom of many disease conditions. When you begin to treat pain, you are not using pain. That is more of a symptomatic treatment. When the cause of the pain is treated, you might not even need to live on painkiller.
Painkillers.
So a good doctor should be able to tell you the need of curing the cause of the pain than taking painkiller for a long time that will now, result to the destruction of the lining of the stomach, thereby causing the peptic ulcer disease. Not only that, when you avoid excessive intake of alcohol, you're also preventing, peptic ulcer. Then the use of spicy food, excessive salt intake, fried foods. When you take foods in moderation, of course, you're also preventing the peptic ulcer disease.
Okay. Let's look at treatment. How is treatment like?
Yes, the treatment of peptic ulcer is after a laboratory investigation has been done. Okay. As I said earlier on, the commonest cause of peptic ulcer is Helicobacter pylori. So when we do the urea breath test, it's a test that is conducted where the presence of Helicobacter pylori is not detected in the carbon label urea breath test. Of course, we cannot do what we call the elimination therapy by trying to kill or destroy this bacterial organism from the stomach. Not only that, we can also evaluate the presence, because not actually all symptoms that patient presents, not all abdominal pain.
All right, Doctor, hold on. I think we have a call now. Hello, caller. Good afternoon.
Good afternoon, ma'am.
Okay, good please tell us your name and ask your question.
My name is Victor. I'm calling from Benin.
Okay, go ahead with your question, Victor.
It's not concerning the ulcer. There's something I want to confirm, ma'am.
Okay.
My wife, before she had a nursing flow, she was really busy. So I thought it was pregnancy, so I thought breastfeed and it showed she was pregnant. But she's still seeing her menses and she's feeling pains.
Okay, your wife is pregnant, she's still in her period and she's having pains. How old is the pregnancy?
Just like 3 weeks now.
3 months?
3 weeks.
3 weeks pregnancy, doctor.
Okay, might just be an implantation bleeding.
Okay.
Well, it's possible for somebody to bleed physiologically when the blastocyst or the embryo is trying to implant to the endometrium of the uterus. Your wife can just experience small bleeding at that particular point in time. But it's not a thing that you have to overlook. An ultrasound scan will have to be done to see if it's a placenta problem. Because when the placenta is at the lower segment of the uterus, so that might also, what we call placenta previa, that might also be the cause of the bleeding. Okay. So I would advise you to go and do an ultrasound scan. But notwithstanding, if an ultrasound scan is conducted and the embryo is in a good state, it therefore means that it's a physiological bleeding, what we call the implantation bleeding.
Okay, thank you for calling. So, doctor, let's continue with our treatment.
Yes, the most important thing is for us to know the incriminating cause of this ulcer. And I will tell you that if other test is conducted, like the gastroscopy or the gastroduodenoscopy, we will be able to know if actually the pain.
Hello, caller. Can you reduce the audio level in the television set and ask question? Who are we speaking with? Hello? Okay, doctor, just go on. I'm sure.
So we have to know exactly if the cause of the pain is as a result of peptic ulcer, because other pains might also mimic the peptic ulcer. It could be pancreatitis. It could be, a gallbladder disease. So these are the things that we have to roll out before we now say, okay, we have to treat this ulcer. The reason why laboratory investigation, we cannot use the symptom alone to treat the patient. There are other tests that have to be carried out. And not only that, surgery might also be an option, especially when there are complications. I will tell you that patients who have had just a normal peptic ulcer in the past, but with complication of perforation means that with time, there is now a white tear in the lining of the stomach or the duodenum, as the case may be.
Okay, we have a call. Hello, caller. Hello. Okay, I think the caller left. All right, doctor, what's the way forward now as we round up?
Yes. You see that in treatment of the peptic ulcer, there are medical treatments, there are surgical treatments. But the surgical treatment, most often than not, is when the medical treatment phase. When I say medical treatment, it involves the use of medication without surgical intervention. So when we plan patient for surgical intervention, it means that the medical treatment is not working. And in that case, we can even bypass the stomach if there is, a sore. When we say ulcer means sore. Just like the way somebody can have a sore in their lower leg or their leg, as the case may be. So the sore in your stomach is what we call the ulcer. So we can bypass the sore, or we can even do what we call a partial gastrectomy by cutting off that sore, doing a repair, what we call Barrett type 1 or Barrett type 2, depending on the bypass we want to do.
Okay, Dr. Jolly, our time is up. I want to say thank you so much for finding time to be with us on the program, and we hope to do this again. A lot of persons now know that ulcer can be very dangerous and it can be very deadly if you do not take action on time. So thank you, doctor, for your time. We'll see you again next week on the program Healthy Living. Bye-bye.
This is ITV.